the Mobile County Health Department and the Alabama Department of Public Health both released statements about the coronavirus this afternoon.
It reads in part, both agencies are working with the Centers for Disease Control and Prevention and other partners in preparing Alabama communities for the possible spread of COVID-19. Identifying the virus remains an issue for doctors in the U.S.
NBC 15's Justin Moore spoke with a Mobile doctor who thought she actually had a case in her office recently. Justin?
That's right, Greg and Kim. The CDC is the only agency able to test for COVID-19. That became an issue in our area when a doctor was faced with a suspected case of the coronavirus.
I have had one case that I was very worried about.
Dr. Thomasina Anderson Sharpe says several weeks ago she had a COVID-19 scare in her West Mobile office. She had a patient who tested positive for the flu with a fever just 7 days after returning from Turkey.
We treated him for the flu, but I went ahead and did the chest x-ray, the blood work, and cautioned him to stay away from other people.
This is the challenge doctors face. Testing for the coronavirus cannot be done on the local level anywhere in the U.S. Right now, the only way to test for the virus is through the CDC. Blood samples, mouth and nose swabs, and cough specimen is given to the county health department and mailed overnight to the CDC in Atlanta.
While their testing is pending, if they are well enough to stay at home and monitor their symptoms at home, then that's what we would like for them to do.
Dr. Randy Murphy with the Bureau of Disease Surveillance at Mobile County Health Department says initially the CDC sent test kits across the country to agencies. The test kits did not work.
But I think in a rush to try to get it out, there was maybe a reagent that wasn't behaving properly.
The CDC is currently producing new test kits expected to be delivered across the country as early as next week. Dr. Sharpe says the virus has a very distinct look on an X-ray. She fears one day the Gulf Coast could see a case.
I don't doubt that this being now on the edge of pandemic, if not a pandemic already, that we're going to see some COVID-19.
Now, in case you're wondering, she says the patient we mentioned in the story did not have the virus. Coming up at 6, hear how she keeps herself healthy from all the illnesses she treats in her office. Kim?